Now, a lot of people here can get confused why that is IVC, not portal vein. So I'll tell you a very, very interesting concept here. I used to get a lot of confusion in this कि यार ये कौन सी artery है, कौन सी vessel है. So I developed a rule and I call it as a line versus dot principle. If you can understand this principle, I think you will not commit a mistake about any vessel in a cross section. It is for cross sectional anatomy. It is for the cross sectional anatomy. It is line versus dot principle. Now, what is this line versus dot principle? Imagine a vessel in my body which is placed like this. Let us consider this as the aorta. You know, aorta is going like this. Aorta is vertically oriented in my body like this. Now, please think about this aorta. If I take a transfer section of the aorta, please see to it. If I take a transfer section of the aorta, tell me whether it will be seen as a line or a dot. If I take a transfer section of the aorta, what do you think? It will be seen as a line or a dot? Or line versus circle, you can also say, not the dot. So it will be seen as a dot. Very good. If I take a coronal section of the aorta, now tell me, in a coronal section, it will be seen as a line or a dot? In a coronal section, can I say in a coronal section it will be seen as a line? In a coronal section it will be seen as a line. If I take a sagittal section of the aorta, anybody who can tell me whether it will be seen as a line or a dot? If I take a sagittal section of the aorta, will it be seen as a line or a dot? It will be seen as a line. That's all. All that you need to remember is how the vessel is oriented in the body, and if you have taken a section, will it be seen as a line or a dot? So what I am going to do is, I am going to write certain vessels and you have to tell me how they will look like in a transfer section. And probably if you can answer this, rest of these problems will be sorted. In a transfer section, how these vessels will be seen. Okay, let me see. Inferior vena cava. IVC, inferior vena cava. Inferior vena cava. Tell me whether it will be seen as a line or as a dot. So inferior vena cava will be seen as a dot. Inferior vena cava will be seen as a dot. Okay. Renal artery. Renal artery will be seen as a line or as a dot? Renal artery will be seen as a line or as a dot? It will be seen as a line. Okay. Portal vein. Portal vein. Portal vein will be seen as a line or a dot? Portal vein will be seen as a line. Okay. Common carotid artery in the neck. Common carotid artery in the neck will be seen as a line or as a dot? Common carotid artery will be seen as a dot. Okay. MCA, middle cerebral artery. Middle cerebral artery, the main branch of the middle cerebral artery will be seen as a line or a dot? It will be seen as a line. So using this, you can relate to this, that which is this vessel. Anatomical direction will help you in locating the anatomy in a pretty simple way. For example, now this is, what do you think, is a line or a dot? It's definitely a line. If it's a line, can it be IVC? It cannot be an IVC. And this vessel that you could see is portal vein. This is what you could see is the portal vein. This remains liver. This remains spleen. This remains spleen. Okay. Now, what is this structure? This structure is right kidney. And what is this structure? This structure is left kidney. This structure is left kidney. Okay, now let me see who can answer this. Anybody who can tell me what is this structure that I have marked 1. Now this structure is aorta. Now you have to apply brain also. This structure is aorta. You know, renal artery comes from the aorta. This vessel that you could see is the renal artery, and that is definitely the right renal artery, as you could see. Let me just remove it, and that's a challenge that we have to do. This is renal artery. Okay, this is renal artery. Now the structure anterior to the aorta can never be renal artery. Please understand that, because had it been renal artery, it would have been originating from the aorta. It cannot be renal artery. This is something that is crossing the aorta from the left side and going anteriorly to the aorta. So it has to be renal vein. It has to be renal vein. And which renal vein? Right or left? Which renal vein? Right or left? So this is left renal vein. This is left renal vein. And the point to be noted, because left renal vein has to go from the left, cross the aorta and reach to the right. Left renal vein is much longer than the right. Left renal vein is much longer than the right. And anybody who can tell me what is the clinical significance of this statement? The left renal vein is longer than the right. What is the clinical significance of this in our practice? The donor kidney that is chosen for the transplant is usually the left kidney. The donor kidney that is chosen for the transplant is usually the left kidney because left renal vein is longer and it is easier to harvest it. It is easier to harvest it. If you have to take the right kidney, you have to take a cup of IVC, which is very challenging. So the left donor kidney is usually preferred for the transplant because the left renal vein is longer than the right.